The members of this research group include Marissa Burnett, Anna Devers, Esther Monjes, Natalie Morrison, Ann Baraggio, and Jordan Robertson. We decided to research different treatment options for infantile colic, also known as excessive fussiness with no definitive cause. The purpose of this research is to better understand which interventions are effective in treating infantile colic. Colic has been associated with increased maternal depression and shaken baby syndrome. Discovering successful ways to treat colic will allow parents to feel confident as they navigate caring for a child, as well as providing reassurance that the infant is comfortable and content.
We chose this graph to show the difference between an infant's average crying time versus the crying time of a colicky baby. The peak age for the most crying per day is between 4 and 10 weeks old, and within this range, the colic baby will cry on average 160 minutes more than the non-colic babies per day. As you can note, the yellow line records when a baby is crying for 3 hours or longer, which is a very common finding among infantile colic cases.
A facilitator in our research was the JMU Library database. We used several articles and studies from different databases which were found on JMU libraries. Some examples are PubMed, Midline, and CINAHL. When searching these databases, we used terms such as infantile, colic, probiotics, therapeutics, and treatments. To ensure these articles were up to date, we only used studies that were published in the last 5 years. These facilitators helped us obtain the results to our PICO question.
As we look into this research and work toward implementing probiotic use to ease colic, we notice that there are some barriers that may prevent effective use of the intervention. For example, each baby is different. Therefore, the probiotic may not be 100% accurate treatment for these babies. We may need to work through trial and errors for each baby and family to find what works best for them. Overall, this could take time and patience from the parents and families. Lastly, there is some biased effectiveness found in the research of using probiotics, so we need to be more mindful about these biases.
As nurses, it is important for us to educate new parents on the signs and symptoms of infantile colic. Offering support is crucial to helping families through this time. While there is some suggestion that probiotics may help colic, ultimately more research needs to be done to determine the most effective treatment. We suggest creating access to the probiotic Lactobacillus reuteri on neonatal floors and providing equipment simulation and our professionals that train in conducting behavioral methods such as rocking and massages.
As a conclusion, studies do show that there is not one definitive treatment for infantile colic. Many infants that received the probiotic Lactobacillus reuteri did have evidence of a higher outcome of reduced crying. There are certain barriers that we may face when implementing probiotic use, that being that every infant is different and the effect can negatively impact one baby opposed to another. With that being said, we also recommend different interventions like swaddling and sucking as another form of treatment. Every infant cries, but excessive infantile colic can be very stressful and overwhelming for families. Through our research from different studies, we have discovered different ways to ease a colicky infant.